So thank you very much, Dr. Sekimpi Deogracius, who is the General Secretary of the Uganda National Association for Community and Occupational Health, for that, for those important remarks. And we shall follow up as the Uganda Medical Association, working together with the UNACO to see how best we can, ensure the life of our workers who are experiencing hazards. We had a claim of several lives of Ebola even in West Africa, one Ugandan doctor a couple of years back. And these are important aspects we need to consider. Without wasting time, I will request Dr. Margaret Mungherera, who is the President Emeritus of the Uganda Medical Association. She was the President of the Uganda Medical Association for almost 10 years. So she can actually give lessons to President Museveni about how to govern effectively. But also, she is the immediate past president of the World Medical Association. Dr. Margaret Mungherera, your role is to welcome the minister, and I'll leave that to you.
Thank you very much, Honorable Minister. Honorable Minister is a lawyer. He's our learned friend. For us, we are from the noble profession and we are from the learned profession. I don't know which one is above which one, but we are very happy to have you here. And I really want to add my welcome to the Kenyan Medical Association team and the Kenya doctors. They've come this time with a fan club, but you're very welcome. And of course, welcome the Uganda Medical Association. We started this, just to add on, we started this some time back in the early 2000s because it was felt that it was important for us as professionals to begin to work together. Because diseases don't have barriers. And a lot of the things, the way we are taught, the way the teaching is, it's really the same. And the diseases are the same. So we thought, how do we get in line with what was happening in the East African community to be able to increase, to make it easy for doctors and other health professionals to be able to move in the region and serve the region. And therefore, we started this collaboration. It was actually between, initially, the Kenya Medical Association and the Uganda Medical Association. And as the Medical Association of Tanzania joined us at that time, there were 3 member states of the East African community in the early 2000s. And we then worked very hard to make sure that our regulatory bodies and our ministers of health, who had never met at that time, we brought them together, and we actually signed a communique, which was signed by the Kenya Medical Association, the Kenya regulatory body, the Tanzanian one, the Ugandan one, and the East African Deputy Secretary General of the East African Community. And the idea was that the ministers of health, that would be working together as partners. We formed what was called the Federation of East African Medical and Dental Associations. And we are pushing on slowly. That association, federation, is supposed to be registered, just like you have the East African Lawyers Association. But we've been dragging our feet a bit. And one of the things that we wanted to do, as I said, was to make it easy for people to to work without having to meet any encumbrances. And actually we have achieved it. What is happening now is that the 6 member states, including Southern Sudan, the regulatory bodies are now working together. They approve medical programs together. They inspect schools together. They have harmonized their laws. We are now looking at having an East African Health Regulatory Council. That is where we are moving. In other words, you cannot start a medical school in Uganda when the people from Burundi, Rwanda, Kenya, Tanzania have not approved it. So we are we've tried to standardize the training of professionals, but also the practice, how we practice. I don't know if the Ugandan doctors are listening. I don't know. Yes, they are. Okay. So then we are moving very fast, and we brought in this game because Matthew Lukwiya had been a very active member of the Uganda Medical Association. And actually, when the Ebola epidemic came, he had just presented a paper on tobacco. I remember it was tobacco bias. And he got this phone call at the Uganda Medical Association conference, and he said to us that, people, I have to go. There's a disease up there which I don't understand. We don't understand, and I need to move. And he left the meeting, our conference, and quickly moved to Gulu, only to hear that somehow along the way, as he was doing his work, he removed his mask, and one of the patients actually, I think, vomited or something. Yeah, and as a result, he succumbed to it. We really want to recognize doctors who work in very difficult situations, and I think some of them are probably here. And you know yourself, being a member of parliament in that region, and you know how difficult it is to attract people to stay there, and to be able to have people who are there, like Matthew Lukwiya. I think we need to really commend such doctors and support them. And I think I'll stop there and invite you to come and